The truth about enlarged prostate and frequent nighttime urination. If you're a man over 60 and you've been told it's normal to wake up 3 or 4 times a night just to pee, I'm here to tell you that's a lie. It's not normal. It's not harmless. And the real reason it's happening might shock you. There's one simple habit, something you do every single day without even thinking, that is quietly inflaming your prostate, disrupting your sleep, and slowly eroding your quality of life. And yet, no one is warning you. Not your friends, not your family, and sadly, not even your doctor. Most men think their prostate gets bigger just because they're getting older. But that's only half the truth. What if I told you that your age isn't the main problem? That this one overlooked daily behavior is triggering a silent inflammation that causes urgency, dribbling, and all those frustrating late-night bathroom trips? Stay with me because in the next few minutes, I'll reveal what that habit is, why it's so dangerous, and how to stop it naturally without medication or surgery. I'll also show you a 15-second bedtime ritual my patients use to sleep through the night and finally feel like themselves again. Daily habits that affect your prostate. Here are 10 common habits that could be impacting your prostate health and, as a result, your well-being. Habit number 10, cutting back on water to avoid nighttime urination. I can't tell you how many times I've had men in their 60s, 70s, even early 80s sit in my office and proudly tell me they've started drinking less water in the evening so they won't have to get up and use the bathroom at night. And every time I gently shake my head and say, I know you mean well, but that habit may actually be making your symptoms worse. It sounds logical, right? Less water means less urine, fewer trips to the bathroom. But here's the part no one tells you. When you cut back on water too much, especially later in the day, your urine becomes more concentrated. It turns darker, more acidic, and more irritating to your bladder. That irritation creates pressure. That pressure pushes against your already sensitive prostate. And the result? You may actually feel the need to urinate more frequently, not less. When the bladder is constantly exposed to concentrated urine, it becomes agitated and overactive. It sends premature signals to empty even when it's only half full. And that's exactly why so many men wake up at 1 a.m., then 3 a.m., then 5 a.m., running to the bathroom with urgency only to pass a small trickle. It's frustrating, it's exhausting, and it slowly chips away at your confidence and quality of life. Dehydration is one of the most overlooked triggers of prostate inflammation. Without enough water, your body can't flush out toxins, your tissues swell, and healing slows to a crawl. The solution: hydrate consistently throughout the day. Don't wait until you're thirsty. That means you're already behind. Instead, sip small amounts regularly from morning until early evening. Aim for light, clear urine. And if you're worried about drinking too close to bedtime, just taper off water about 90 minutes before sleep. But don't stop altogether. Water isn't the enemy. It's your ally. It's the most natural, accessible tool you have to calm the bladder, reduce prostate pressure, and sleep through the night peacefully. Habit number 9, sitting for long periods without movement. I remember one of my patients, a retired school principal named Frank. He told me he spent most of his day sitting, watching TV, reading the newspaper, or working on puzzles at the kitchen table. "Doc," he said with a chuckle, "I earned this rest." And he had. But what Frank didn't realize, what most men don't realize, is that too much sitting, especially as we age, quietly works against our prostate health. Here's what happens. When you sit for long periods, especially without standing or stretching, you place constant, low-level pressure on your pelvic region. That pressure reduces blood flow to the prostate, and when blood flow slows, inflammation builds. The body can't deliver nutrients as efficiently. It can't carry waste away. The tissues around your prostate start to swell, and you may begin to notice more urgency, a weaker stream, or even discomfort when you sit. It doesn't happen overnight, and that's what makes it so dangerous. It creeps in slowly. A few bathroom trips here, a restless night there, a growing feeling that something just isn't right. I've seen it so many times. Men who feel trapped in their chairs and then become trapped in a cycle of worsening symptoms. The truth is, our bodies were designed to move. Movement isn't just about fitness or losing weight. It's about circulation. It's about energy. And for men over 60, it's one of the most powerful ways to protect the prostate. The good news is, you don't need a gym membership or a fancy routine. One simple rule can make all the difference. Every 30 minutes, stand up. That's it. Just stand, stretch your arms, take a few steps, look out the window, set a gentle reminder if you need to. These micro movements release pressure, restore blood flow, and signal to your body that it's still active, still vital, still alive. Habito 8. Overconsumption of caffeine. I'll be honest with you, this one hits close to home. I love the smell of fresh coffee in the morning. That first warm sip can feel like a small gift. And for many of the men I see, especially those who are retired and finally enjoying slow, quiet mornings, that daily cup of coffee becomes almost sacred. But here's what I've learned after decades of treating prostate issues. Too much caffeine, even from something as familiar and comforting as coffee or tea, can quietly wreak havoc on your bladder and your prostate. Caffeine is a stimulant. It doesn't just wake up your brain, it wakes up your entire urinary system. It increases urine production and stimulates the bladder muscles, often leading to more frequent urges to go. For a healthy young man, this might be a minor inconvenience. But for someone over 60 whose prostate may already be slightly enlarged, that extra stimulation can push things over the edge. You may find yourself rushing to the bathroom more often, especially in the late morning or afternoon. Or maybe you feel like you're never quite emptying fully. That lingering pressure, the urgency, the occasional dribble, it may all be tied to how much caffeine you're consuming. Now, I'm not saying you have to give it up entirely. I wouldn't ask you to. But moderation matters. That single cup in the morning, enjoy it. But consider stopping there. Your prostate and your sleep might thank you. Diet, lifestyle, and prostate health. Habit 7. Eating processed and spicy foods. Regularly, I had a patient named Bill, 68 years old, who came to me frustrated. He said, "Doc, I've cut back on soda. I'm trying to walk more, but I'm still waking up at night to pee, and it's driving me crazy." I asked him to walk me through his daily diet. He paused, then laughed. "Well, breakfast is usually bacon and eggs. Lunch might be a sandwich with deli meat, and I can't give up my spicy chili at dinner." That's when the real conversation began. What many men don't realize is that food isn't just fuel, it's also information. Everything you eat sends a message to your body. And highly processed foods like bacon, sausages, frozen meals, and even packaged snacks are sending the wrong message to your prostate. These foods are loaded with chemicals, unhealthy fats, and artificial preservatives that increase inflammation throughout the body. When your prostate is already sensitive, these inflammatory signals make things worse. But it's not just processed foods. Spicy foods, especially hot peppers, chili powders, and sauces, can directly irritate the bladder and pelvic nerves. And when those nerves are overstimulated, it can feel like your bladder is full, even when it's not. The real issue, though, is what these foods do to your hormones. Many processed meals contain trans fats and added sugars that raise estrogen and lower testosterone levels. That hormonal imbalance is a proven driver of prostate growth. Swapping your usual meals for more whole foods like grilled chicken, leafy greens, avocado, and berries can make a big difference. Habit number 6. Holding your urine for too long. It always surprises me how many men brush this off as no big deal. "I was stuck in traffic," or "the game was on, I didn't want to miss the second half," or "I figured I could wait until the next rest stop." I get it. Life is busy. But as a doctor who's spent over 3 decades treating men's health issues, I can tell you this seemingly small habit of holding in your urine is one of the most underestimated causes of prostate trouble I see. Let me explain what's really happening. Every time you resist the urge to go, your bladder stretches a bit beyond what it should. That constant stretching creates downward pressure directly onto your prostate. And your prostate, especially after age 60, isn't built to handle that kind of pressure repeatedly. Over time, that pressure irritates the delicate tissues, causes swelling, and can even create tiny injuries to the nerves and muscles that help you urinate properly. That's why men who make a habit of holding it often end up struggling with a weak stream, that incomplete feeling after going, or even increased frequency later on. And there's more. When you delay urination too often, your bladder may not empty completely, leaving behind small amounts of urine. That stagnant urine becomes a breeding ground for bacteria, leading to infections, which only further inflame the prostate and irritate the bladder. When your body says, go, go, don't wait, don't hold it, your bladder and prostate are a team. When one suffers, the other does too. Listening to your body isn't weakness, it's wisdom. Habit number 5, smoking, or even being around smoke. I'll never forget a man named Walter who came into my office a few years ago. He was 72, proud, strong-willed, and had worked construction most of his life. He looked me in the eye and said, "Doc, I quit smoking 10 years ago, but my prostate's still giving me hell." When I asked if he was ever around other smokers, he paused and nodded. Every Friday night poker game, my buddies light up like it's 1975. What Walter didn't realize is that the prostate is incredibly sensitive to environmental toxins. And cigarette smoke, whether you're inhaling it yourself or just breathing it in secondhand, is one of the most damaging exposures you can face. Each cigarette releases thousands of chemicals, many of which restrict blood flow, decrease oxygen levels, and trigger chronic inflammation throughout the body. That includes your prostate. Over time, these chemicals interfere with the gland's ability to heal and regenerate. Blood vessels that feed the prostate begin to narrow. Tissues become stiff. Immune cells rush in, not to help, but to contain the constant assault, keeping your body in a state of low-grade inflammation. And if you're over 60, your ability to detox from that damage naturally has already slowed. What's more alarming is that long-term exposure to cigarette smoke doesn't just worsen benign prostate enlargement. It can increase your risk of developing more serious conditions, including prostate cancer. This isn't meant to scare you. It's meant to wake you up because it's never too late to make a change. Care and awareness. Habit number 4, skipping yearly prostate checkups. Not long ago, I sat across from a man named Henry. He was 66, well-dressed, polite, and clearly uncomfortable. He had been dealing with frequent urination, low energy, and a lingering ache in his lower abdomen for over a year. But this was his first time seeing a urologist. When I asked him why he waited so long, he shrugged and said, "I didn't want to know." Henry isn't alone. A lot of men, strong, intelligent, hardworking men, avoid doctor visits until they can't ignore the symptoms anymore. And I get it. There's fear, there's pride, sometimes there's embarrassment. But here's what I always say. You take your car in for an oil change every few months, not because it's broken, but to keep it from breaking. Why should your body deserve any less care? The prostate is a tricky organ. When it starts to swell or act up, it often does so quietly. No pain, no obvious warning lights, just subtle changes. By the time it becomes obvious, the problem may already be advanced. But when caught early, many prostate issues, whether it's benign enlargement or even early cancer, can be managed with simple lifestyle changes and non-invasive treatments. That's why annual checkups are so important. A basic physical exam, a PSA blood test, and yes, sometimes a digital rectal exam can provide life-saving information. These tools aren't about diagnosing disease. They're about preserving health, giving you the chance to stay ahead of problems, not chase them down later when they've grown too big to ignore. Habit number 3, Eating too much red and processed meat. I remember a man named Joe, 70 years old, a retired Navy, proud Texan. He came to see me after struggling for months with interrupted sleep, a sluggish urine stream, and a growing discomfort in his lower pelvis. We went over his lifestyle, and when we got to his diet, he chuckled and said, "Doc, I'm a steak guy, always have been. Nothing beats a good ribeye." I smiled because I hear that a lot, and believe me, I get it. There's something deeply satisfying about a hearty, meat-centered meal. It's part of the culture, the routine, even the reward after a long day. But what most men don't know is that a diet heavy in red and processed meats can quietly fuel the very inflammation that's making their prostate problems worse. These meats are packed with saturated fats, preservatives, and chemicals that over time lead to chronic low-grade inflammation throughout the body. And when your prostate is already enlarged or sensitive, that inflammation acts like gasoline on a fire. It contributes to swelling, hormonal imbalance, and increased urinary symptoms. Beyond that, regular consumption of red and processed meat has been linked in multiple studies to a higher risk of developing more serious prostate conditions, including cancer. The food you eat every day is one of the most powerful tools you have. It can either fight inflammation or feed it. You don't have to give it up completely. Just bring more balance to your plate. Focus on whole, unprocessed foods. Your prostate will notice the difference far sooner than you think. Habit number 2, belly fat and obesity. I had a patient once named Leonard. He was 64, soft-spoken, and always tried to keep a good sense of humor, even when his symptoms were frustrating. He sat down in my office and said, "Doc, I know I've put on some weight around the middle, but how much harm can a belly really do?" I looked him in the eye and gently replied, "More than you think, Leonard, especially to your prostate." Excess belly fat isn't just extra weight. It's a metabolically active tissue that sends powerful hormonal and inflammatory signals throughout your body. This kind of fat, especially around the waist, isn't just sitting there quietly. It's working against you. It converts your valuable testosterone into estrogen, which can directly contribute to the growth of prostate tissue. And as estrogen increases and testosterone falls, the prostate begins to enlarge, leading to more frequent urination, weak flow, and that persistent feeling of pressure. Belly fat also produces chemicals that promote inflammation, strain your cardiovascular system, and make it harder for your body to regulate blood sugar and blood flow, both of which are critical for overall vitality and sexual health. So, while it may seem like a cosmetic issue, that expanding waistline can actually signal a deeper internal imbalance. The good news is that you don't need to lose 30 or 40 pounds to see results. Studies show that even a modest 5% reduction in body weight can have a noticeable impact on prostate symptoms. The path doesn't have to be overwhelming. Habit number 1, chronic uncontrolled stress. Of all the things we've talked about, your diet, your habits, your daily routines, this is the one most men overlook. And yet, it may be the most powerful force affecting your prostate health. I've had patients sit across from me, well-dressed, polite, calm on the outside but carrying the weight of decades on the inside. One man in particular, Richard, told me, "Doc, I'm not the kind of guy who talks about stress. I just keep moving." And I nodded, because I know that story too well. Men, especially those over 60, were raised to keep it all together, to be the rock, to tough it out. But what we now understand medically and emotionally is that chronic stress doesn't just live in your mind. It lives in your body, and your prostate feels it. When you're under constant stress, your body produces elevated levels of cortisol, the stress hormone. Cortisol fuels inflammation, tightens the pelvic floor muscles, disrupts hormone production, and interferes with sleep. Over time, it lowers your testosterone and increases your sensitivity to pain and pressure in the pelvic region. This creates the perfect storm for prostate problems to develop and linger. Managing stress isn't weakness, it's strategy. It's leadership over your own health. And it just might be the foundation that makes every other habit easier to change. You are not broken, you're just uninformed. Over the years, I've sat across from hundreds of men just like you, frustrated, exhausted, and silently worried about what's happening to their bodies. Some feel embarrassed, some feel angry, most feel alone. And after hearing their stories, I can tell you this with complete certainty. You are not broken. You're not weak. You're simply operating without the full picture. And now that you have it, everything can change. We've walked through the 10 most common habits that silently inflame the prostate. Cutting back on water, sitting too long, too much caffeine, processed foods, ignoring nature's call, exposure to smoke, skipping checkups, red meat overload, belly fat, and chronic stress. Each of these might seem small in isolation, but when stacked together day after day, they quietly create the perfect environment for your prostate to swell, your sleep to suffer, and your sense of control to slip away. But here's the part I want you to hear louder than anything else I've said. You have the power to reverse course. And it doesn't take radical change. It takes awareness. It takes small, intentional steps taken consistently. It takes listening to your body instead of overriding it. And it takes treating yourself with the same care and urgency you'd offer to someone you love. Your prostate is listening, and now you have a voice that knows what to say. You are not broken. You are not weak. You were just uninformed. And now that you have the full picture, everything can change. Your journey to better prostate health begins with one small step. If this video helped you in any way, please take a moment to like it, share it with a friend or a loved one who may be silently struggling, and leave a comment below about which habit impacted you the most. Together, we can build a community of men living with more vitality and strength. Remember, your body isn't at war with you, it's trying to communicate. And now, you understand the message. With warmth and strength, Dr. Lauren Hart.